Welcome to HFMA's Annual Conference 2025 in Denver. I'm excited to be here today with an executive from Candid Health. We're going to have a great conversation.
Looking forward to it.
Welcome.
Thank you.
So let's think about Candid Health. Tell me about what you do, what problems you're solving. Tell me about Candid Health.
Absolutely. Well, first off, my name is Doug Proctor. I'm the COO and one of the co-founders at Candid. Thank you so much for having us here. Super excited to chat. Our mission at Candid is to reduce the administrative burden of healthcare. Specifically, what we're basically focused on is building a general data integration platform that brings together all of the necessary data elements that providers need in order to automate the end-to-end RCM process. And then we build an automation layer on top of that. I think if you think about pre-existing options that exist for providers in the space today, it's a lot of legacy options that were really fit for purpose in the early 2000s, sort of inch deep, mile wide, or you have these point solutions. I think what we're doing at Candid is kind of rethinking from the ground up, what should an RCM automation platform be today in order to really manage all of the end-to-end complexity that exists. So the way we're doing that is we've rethought really the kind of lowest tactical level of the end-to-end problem space. We've rebuilt the EDI layer, we've rebuilt the data model layer, we've rebuilt the end-to-end discrete unit operations of the process, kind of going end-to-end in order to just try to focus on increasing net collection for providers, reduce cost to collect, and then give fundamentally a really scalable and open technical architecture, APIs accessible for everything so that you can integrate really effectively with this very broad and complex sort of industry.
So one of the things you mentioned was that legacy, right? So RCM solutions have been around forever.
Yeah.
So tell me about what makes Candid different.
For sure. I think it probably starts with how we're thinking about the problem and how we're thinking about the mission. So Nick Perry, my co-founder and our CEO, and I first met at Palantir. We were there for 5+ years. Nick really got a chance to see firsthand at Palantir how broken the claim adjudication systems were on the payer side. For my part, I worked on sort of the military and defense side of things. But I think in both cases, what we really learned through our education at Palantir was going to the lowest tactical level, getting on the edge with the user. So Nick and I both spent our first couple of years at Candid literally just being billers. And I think that's a little bit different. You sort of learn the problems of the industry from the ground up. That really gives you an understanding and an appreciation for really what makes the problem hard. So I say that's number one, is like kind of a deep understanding of what makes this industry really hard to make sure you're actually solving from first principles. I think second is an ambition around what do we actually want to accomplish? Like, we're not in this just to build another RCM platform that's going to make a bunch of money and not move the needle for our customers. We have a very clear and specific view of the value we want to create for our customers. And then I think in between that kind of low level, kind of first principles problem and the sort of long-term mission and vision, it's the how. It's a focus on relentless execution for our customers, deploying new technologies in order to actually move the needle for them in a real way. And I think a lot of the new technologies that exist today really make it the right time for disrupting kind of the legacy RCM problem space.
So everybody's talking about automation and AI. It seems like an obvious solution, but what's your take?
It's a great question. First off, I would say I am a huge proponent. I think AI and machine learning, conventional machine learning techniques as well, are going to be incredibly impactful in RCM. I think my take would be maybe slightly different from kind of the overarching kind of just deploy a large language model on top and really kind of disrupt from that point. I think for us, it's really about building the fundamental bottoms-up pillars in order to then effectively deploy and leverage AI in the context of the broader system we've built. Specifically, if you think about what we've built, I talked about that kind of general data integration platform. I talked about rebuilding the EDI and data model and the end-to-end unit operations. RCM is hard in part because you need to do a lot of discrete tasks. You need to submit claims, resubmit claims, void claims. When you resubmit claims, is it a fresh claim or a corrected claim? And there's a lot of complexity in there that I think if you think about sort of deploy a large language model, you might miss the opportunity to really engage with what makes this problem hard. And so I think the way we think about it is LLMs, AI have a huge role to play, but I think it's alongside some of that more deterministic business logic. It's the ability for an operational user who knows what they want to do to be able to tell the machine, this is what I want you to do. But in cases where there might be ambiguity or kind of more expensive, time-consuming, rote human tasks, yeah, let's deploy some large language models or machine learning models in order to aid the user. Zooming out, I think AI, in our view, is really about accelerating feedback loops to empower human users to do what they want to do faster and more effectively.
That makes a lot of sense. So, I'm an organization. What type of organizations, provider organizations, should pick Candid as an RCM solution?
It's a really good question. I think First off, I would say there's a lot of change happening in the industry, and I think for many provider groups, business as usual is really kind of an existential threat to their existence. Like, costs are rising, and so fundamentally an organization that should pick Candid, I think, is one that is actually committed to decoupling the revenue and cost curves of their business. It means actually rethinking the way that you're going to do things. The traditional models for revenue cycle management, if you look at the legacy providers, were kind of a model of like, put everything in a single system and then offshore the labor. Like, that model doesn't really work. And so if you want to deploy Candid and actually find the kind of success that our customers tend to, I think it relies on a commitment of, let's actually rethink, do we need these armies of people who are spending tons of time doing these manual tasks? I'd say that's number one, is kind of an openness and a willingness to change the way that they've been doing things to date. Second, I would say, is an actual like commitment to excellence. I think our customers that tend to find the most value with our platform are the ones that are trying to be actually the best at what they do. They're trying to get to that 99, 99.2, 99.5% payer net collection rate. And similarly, they're the ones that are trying to actually automate away a lot of the manual labor that they were having to kind of spend tons of time, energy, and resources on in the past. I'd say they're the two biggest things.
So it sounds like big, tangible solutions are achievable with Candid, but how hard is it to drive this transformation, change management, et cetera, that's going to be probably tied to a legacy solution?
Yeah, I mean, I think the way that we've thought about this from day one is meet our users where they are. That means getting on the ground, going and sit with users, understanding what makes their day-to-day painful. At the CFO or organizational executive level, what are the pain points that are kind of imperiling the organization or preventing them from achieving the goals they're trying to get to? Everything we've built has been heavily predicated on a tight interoperability and integration story with all the other vendors and sort of legacy technologies out there. I think we would be insane if we thought that we were going to be able to completely disrupt the industry without building tight integrations with existing players in the space. And so I think that's a huge part of it, is we actually have the ability to deploy out-of-the-box integrations with a wide range of pre-existing technologies where we can create a lot of like tight value for our customers without necessarily having to tear up their entire stack. The flip side, I would say, is that I think the question facing organizational leaders today in many ways is, what is going to happen to your organization if you don't change? You're going to miss out on new reimbursement models for value-based care. You're missing the opportunity to collect your fee-for-service allowed amounts from payers. And so I think for us, it's really about how do we make sure that the ROI story and the narrative and the metrics are so crystal clear in terms of what we're trying to do organizationally, partnering with our customers to make it happen, to make it kind of a no-brainer to want to shift to Candid.
This is great. I really appreciate the time that you spent with us today. I appreciate the insights shared, and it was great getting to know Candid a little better.
Thanks so much for the time. Appreciate it.